CEN test prep exam explanation. Question 1. Priapism is a urological emergency characterized by Option A. Painful, prolonged erection. Option B. Inability to void. Option C. Testicular torsion. Option D. A scrotal edema. The correct answer is option A. Painful, prolonged erection. Question 2. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A. A patient fall that results in a minor abrasion. Option B. A medication error that causes no harm. Option C. A surgery on the wrong body part. Option D. An AMA discharge. The correct answer is option C. Surgery on the wrong body part. Question 3. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from Option A. Peptic ulcer. Option B. Esophageal varices. Option C. A hemorrhoids. Option D. Mallory-Weiss-Tear. The correct answer is option B. Esophageal varices. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates Option A. Normal cellular metabolism. Option B. Hypoperfusion and anaerobic metabolism. Option C. Kidney failure. Option D. Liver failure. The correct answer is option B. Hypoperfusion and anaerobic metabolism. Question 5. Which assessment finding is consistent with a flail chest? Option A. A crepitus over the sternum. Option B. Paradoxical chest wall movement. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Paradoxical chest wall movement. Question 6. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should Option A. Stop the nitroglycerin infusion immediately. Option B. Administer morphine for the headache. Option C. Treat the headache and continue nitroglycerin as ordered. Option D. Switch to oral nitrates. The correct answer is option C. Treat the headache and continue nitroglycerin as ordered. Question 7. A patient presents with sudden onset worst headache of my life. The nurse's first priority is Option A. Administer pain medication. Option B. Perform a complete neurological assessment. Option C. Prepare for lumbar puncture. Option D. Obtain a non-contrast CT scan of the head. The correct answer is option D. Obtain a non-contrast CT scan of the head. Question 8. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A. Abdominal X-ray. Option B. Abdominal ultrasound. Option C. CT scan of the abdomen. Option D. A complete blood count. The correct answer is option C. CT scan of the abdomen. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. The priority patient for a trauma team activation based on mechanism of injury is Option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Question 10. A patient with suspected bowel perforation should have which initial diagnostic study? Option A. CT scan with contrast. Option B. Abdominal ultrasound. Option C. Upright chest X-ray. Option D. Colonoscopy. The correct answer is option C. Upright chest X-ray. Question 11. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A. Patients with private insurance only. Option B. Any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. Question 12. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 13. Pulsus paradoxus is a classic finding in which condition? Option A, cardiac tamponade. Option B, pulmonary embolism. Option C, aortic aneurysm. Option D, congestive heart failure. The correct answer is option A, cardiac tamponade. Question 14. A patient with a spinal cord injury at T1 is bradycardic and hypotensive. This is characteristic of: Option A, hemorrhagic shock. Option B, cardiogenic shock. Option C, neurogenic shock. Option D, septic shock. The correct answer is option C, neurogenic shock. Question 15. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Question 16. A Call's fracture involves the: Option A, proximal humerus. Option B, distal radius. Option C, femoral neck. Option D, tibial plateau. The correct answer is option B, distal radius. Question 17. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes: Option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. Question 18. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Question 20. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock. Option B, distributive shock. Option C, cardiogenic shock. Option D, neurogenic shock. The correct answer is option C, cardiogenic shock. Question 21. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, dry skin and absent bowel sounds. Option C, hyperreflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperreflexia, clonus, and agitation. Question 22. Which of the following is an early, compensatory sign of shock? Option A. Anuria. Option B. Metabolic acidosis. Option C. Tachycardia. Option D. Unconsciousness. The correct answer is option C. Tachycardia. Question 23. Necrotizing fasciitis requires what priority treatment? Option A. Broad minus spectrum antibiotics alone. Option B. Immediate surgical debridement. Option C. Hyperbaric oxygen therapy. Option D. Wound vac placement. The correct answer is option B. Immediate surgical debridement. Question 24. What is the priority intervention for a patient with an open fracture? Option A. Immediate surgical debridement. Option B. Apply traction. Option C. Cover the wound with a sterile saline minus moistened dressing and immobilize. Option D. Administer analgesics. The correct answer is option C. Cover the wound with a sterile saline minus moistened dressing and immobilize. Question 25. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A. A ventricular septal rupture. Option B. Papillary muscle rupture with mitral regurgitation. Option C. Pericarditis. Option D. Aortic dissection. The correct answer is option B. Papillary muscle rupture with mitral regurgitation.